Welcome to this week's episode of Pondering Play and Therapy with me, Philippa.
And me, Julie. And this week it is part two on resistance. A few weeks ago, we looked at resistance that may appear in the room from a child or young person, particularly if they're engaging in therapy. And then this week, we thought we would think about the adults around the child. And the adults may be parents, carers, maybe other professionals. But when there seems to come a sort of sticking point between me, perhaps as the therapist and or the social worker, and some sort of sticking point, what I might call resistance around the work with the child. And today we'd like to just ponder that because Philippa and I, we've talked about this a lot. So often we come across resistance and we wonder about it, we ponder about it, we're curious about it. What is stopping this parent? Why is this parent now or this professional putting the brakes on?
Mm.
And sometimes putting the brakes on is just what is needed. Actually, they're ahead of me by putting the brakes on.
Mm.
So that's where we are today, thinking about that word resistance or a slowing down or a putting the brakes on around a therapy intervention.
I guess there is another type of resistance that can come with risk, though, isn't there? And I wonder if we'll get to that. So there's that hidden compliance that sometimes when you're working with families where there's safeguarding issues or there's risk going on, there's that hidden compliance, or there's resistance that is not always helpful, that maybe prevents the child or the family or the service having what is needed in a way that's beneficial, really. Because I guess resistance can come in many different forms, isn't it? And it's about being curious about that, but knowing that some resistance we can sit with and we can work with, some resistance is going to be at the end where we're thinking, actually, this might this might be a little bit more than being able to sit and hold it. Maybe we need some other support around that because there's a safeguarding risk or especially around hidden compliance, I think can be quite tricky.
Yeah, and I think sometimes, as you said last time when we were thinking about children, sometimes resistance is absolutely necessary and
Mm.
welcome. And actually, a parent, carer, a professional saying, "No, I don't think we're going to be doing that," can actually be the gift. Sometimes there has been over compliance of we'll do whatever other people tell us to do. But actually, sometimes a parent having the agency to say, actually, no, I don't think we need that, can be seen as a form of resistance, refusing a service, perhaps, but actually could be that moment of that parent taking care of themselves and having agency with their child. So, just a very quick example of this. A few weeks ago, I met some new parents. They're birth parents to their own, and they're caring for their own child. And they'd contacted me just locally. So this was a potentially a private client. I had a spare space on my Thursdays, and I had lots of conversations with one of the parents. And then they came to see me in my house. I practice in my house, in my front room. And they shared a lot about their child and about a lot about them, actually. And they were here for about an hour and a half. And as part of that, I always invite parents to do some playing, to do some picking out of figures or stones or in some symbolic way. I ask them each to create an image or a setting that describes how they see their child in the world at the moment. And they were to do it separately. It happened to be a mum and a dad in this situation. I went into our kitchen, made them a proper cup of tea in a proper teacup with china teacups, a teapot and china teacups, brought it back in, and then we looked at both sets of figures together. And it was such a rich conversation. I learned so much about them as a couple and them as parents and about their child. And as they were leaving, I said, look, let's both all take an opportunity to just reflect. Is this the right thing? Is this the right time? I've certainly got a space. Let's be in touch in a week. But within 2 days, they'd got in touch to say, no, thank you. We don't want to have therapy for our child. We've even talked about it with our child. This child doesn't want to do this. We don't feel it's necessary. Actually, the hour and a half with you the other day gave us the opportunity to sit down and really think about ourselves as a couple and about our child, and we can handle it. And we don't need any professional help. But thank you very much. And one of the things we talked about with the children last week is what impact does that have on me as the worker? I have to say, my immediate impact was, I haven't filled that slot. I need to now find another family. And it, as therapists will know, it can be quite a long road. I was like, oh, my day was going to be so neat with this child in there. But also another part of me was immediately delighted for this family that they've gone from a feeling of despair to a feeling of agency and strength. And we've left it open that they can come back at any point to see if they want to do something else. Now, that might be seen as resistance, refusal of a service. But actually, that was the very best thing for them. And I wonder about them. I've kept a few notes, but I just need to see what happens. But they, as a family who are not through an agency, had the choice to do that. So one of the things we've thought about sometimes, isn't it, is, has the therapy been mandated? Has somebody said to this family, you must take your child to therapy? This is an essential part of this foster care arrangement, this early adoption, this birth family reunion plan or whatever. And you've probably got more experience than me in those situations. What is it like? Do you meet resistance from parents, carers, when the therapy has been mandatory? They have to do it.
And I think that's probably a normal part of it, isn't it? Do you know what I mean? If somebody was saying to me, not that you would ever know this, you must do, I'd be like, really, must I? And even if in the back of my mind I was thinking it's a good idea, or yes, that's right, there'd still be a little bit of resistance from me about, actually, I can have my own agency. I can make my own decisions. Why are you saying this? Do you know what I mean? And sometimes what I think is people who are in the system, and by that I mean whether adoption, fostering, birth families, or even, I guess, people whose children are in hospital and those sorts of things, but you're in a system, aren't you? That there's lots of people that have views about how you are being as a parent to the said child, whether that's foster parent, adoptive parent, birth parent, kinship carer, it doesn't matter. But there's people have views, don't they? And as professionals, I often think that they are more willing to share those views. And sometimes that's our job to say, I'm wondering if, but sometimes people can be it can feel that you're being judged. That thing of your parenting isn't good enough, you haven't got the skills, you have got these gaps. And I think if you've been through some kind of assessment, whether it's a fostering assessment, adoptive assessment, or you're a birth parent going through a parenting assessment, people are literally judging, are you good enough to care for this child or these children? And then you have them, and then there's tricky behaviors. There's all these behaviors that we talked about, lots and lots about, that are survival behaviors. They are behaviors that, that for the child serve a purpose, but they don't serve a purpose in your family. And there's a mismatch, isn't there? And you're trying to manage dysregulation, you're trying to fill in gaps, you're trying to parent from a position that you don't understand really, because the parenting that most of us have experienced has been traditional, secure, relatively secure based parenting. You don't have all this information about trauma, about attachment, about, I know that there's courses, but from my experience, people go on these courses and they take the information in, but they always think, just like with birth children, you think it's going to be different with you. I remember having my son and thinking, I'm going to get him dressed every day and he's going to be all nice, and I'm going to be all nice, and I'm going to put him in his little pushchair, and I'm going to walk around the park, around the shops, and I'm going to be done up, and I'm going to have all this time. And actually, really, if I could get out of the house without vomit on my clothes, that was a good day. Do you know what I mean? Some days, do you know what I mean? It's different. The reality of what you think this parenting is going to be like versus what it actually is like, it's very different, isn't it? But when you've been assessed and you've had to prove that you're good enough, and then you're approved, and then somebody comes along and says, yeah, but you need to go on some more courses now, most people would be like, do you know what I mean? Or people have been asking for so long, can you give me some help? Can you give me some help? This is true. And then they're asked to go on a parenting course.
Yeah.
Let's do a parenting course. And the parents are like, I know that the parenting course isn't enough. This kid is really dysregulated. He's not sleeping at night. I can't get him into school. And you're asking me to do therapeutic parenting. And that's the gateway, and that's the first. So I would feel resistance, Julie. I would feel frustrated and mad and resistance. And if you're a birth parent and maybe you're at risk of your child going into foster care or into the system, and how do you process the information you're being given? And if you haven't experienced as a birth parent some of the parenting that you're being asked to deliver, then you're going to have, because I don't know how to do this. Well, go on this course and it'll teach you. Will it really? It might give you information, but having information is very different. Yeah, resistance for that, for me, is an absolute natural part of those processes. For some people, they won't. They'll be like, yeah, this is exactly what I need. It's exactly at the right level, and it's giving me the foundation that I need to move in and develop these skills. For others, it's not.
No, and I think that word approved, which comes certainly in with adopters, you are now approved as an adopter.
And fostering.
And fostering. You're now approved. And that sense of, oh, then that makes me capable of parenting any child who I make a family with. And yet the reality is so different to that. So I think there's shame and there's regret often in that, and a mismatch between the label and the certificate of approved and I seem to be making a real hash of this, or together this is really messy. And that feeling, and I've heard this from so many adopters, of standing at the school gate or wherever you stand to collect children in primary school, little ones, and other parents knowing that you've been approved as a carer, as an adopter, as a parent, and yet your child is the one who's scratching or running around or pulling away or running off from you down the street. And that sense of other people are looking at me, rolling their eyes and saying, oh, if she's approved to be a parent, oh my goodness, if he's approved to be a foster care, oh. So I think that the shame can be part of the resistance, and absolutely understandable. But I'm also thinking about kinship carers who are often related to the child, not always. Grandparent, aunt, uncle, great uncle, big brother, they're related to the child. And say if it's a grandfather and it's his daughter's child that he's caring for, so often I've heard the question from the grandparent of, is it my fault? Did I get it so wrong with my daughter that she's not able to care for her own children? And am I going to get it right this time? Whatever getting it right means. But that sense of, this is my biological granddaughter, grandson, grandchild, and have I somehow been part of the failing? Have I not been good enough? And how will I be good enough this second time around?
Yeah.
So that, I think, is very complex for many parents and carers in accepting help, because it's so loaded, it's so complex, and the help itself could be part of an ongoing assessment.
Mm.
Let's do TheraPlay for 20 weeks. And if things are better, we'll look at this as a stable placement. But let's give 20 weeks to TheraPlay, but after that, if it's still unstable, we need to see this as a placement at risk.
Yes.
So going into the therapy can have all of those pressures. It puts a lot of pressure on the worker as well as on the parent and the child.
And I think also you then, if we're thinking about play-based, even any therapy, I can think about from a TheraPlay point of view. You then build the relationship, because that is my job, is to get that actually this is tricky, and spend whatever time somebody needs to be able to have that relationship, to feel safe enough to come into it. And that's okay, because my job isn't to judge somebody. My job is to be alongside them. But I understand that doctor can sometimes not feel like that in our first few meetings. It takes time to build that trust. And then you come into a therapy room where you have to sit on the floor and play. And as we've talked about in many of these podcasts, play isn't something that naturally comes to everybody. Or touch. You in TheraPlay, you are really close to that other adult, and you are touching them, and you are holding them, and you are singing to them. You're doing quite intimate things in TheraPlay with the child and the adult. This is an adult. The adult is alongside. And understandably, again, for some people, that is, what do you mean you're putting cream on my hand, love? You know, you want to massage my hand with baby lotion? Seriously? Or you're going to almost be sitting on my knee to play slip slide? Or do you know what I mean?
Yeah.
And that is scary, isn't it? So you can see again that you get some resistance from, actually, I don't know how to do this. I don't know how to be this close, or I don't know how to play. And that is a worry. So you get a resistance from that, don't you? And that's not, and again, that's an understandable place to be.
Yeah, and that sense of, for some parents, but we both use TheraPlays. And I don't know if you work in the same way as I do. If I was doing TheraPlay with the family, I'd have a couple of sessions with the adults before I even meet the child, usually, or get into any therapy with the child, to get used to exactly those things, getting on and off the floor. Because of my abilities and disabilities, can't get on and off the floor in a dignified way anymore. I can still do it, but I negotiate with the parent. Are we going to be sitting on the sofa? Are we sitting on the floor? How do we get up? How do we get down? Do we help each other? What's going to be best for the child? And get used to that guiding and that touch that is so much part of TheraPlay. So if a dad's doing a pizza massage on the back of his child, or we're practicing that, that I can see his hands are a bit rougher or a bit too tickly, then I would say, do you mind if I actually touch your hand and give you the kind of pressure that I think your child might need and enjoy? And so these are very unusual ways of being with another adult. And there can be huge resistance. One, because it's a bit weird, two adults in a room blowing bubbles and passing beanbags from one head to another or whatever. It's weird. But also there can be huge sadness because nobody played with them like that. Or perhaps the person who did play with them like that has passed on, has died. And so suddenly there can be big memories of a parent or a grandparent or a neighbor who played so nicely with them as a child, and it suddenly comes back. And so the resistance to go there can be spoken about. But I'm also thinking about, I don't know if you've had this situation, Philippa, when you then get into the room with the child and the parent, sometimes both parents, and that can be complex in itself, because you can sometimes have one parent who's really into it and absolutely do anything, and the other one is, oh, that's too childish, that's babyish, why are we doing that? So you've got those dynamics sometimes. But in the first couple of sessions, I'd mainly work with the child on my own and has the parent as the sort of backup, as the cushion, as the
cheerleader.
Exactly. And very often in the assessments we've done leading up to it, there'll be a sense of how maybe defiant or controlling. These words will come from the parents and the social workers. The child is controlling, compliant, always runs off, always says no. And then in the first couple of therapy sessions, sometimes everything goes beautifully between me and the child. And I'll say, tell you what, I'm going to put a beanbag on your head, and when I count 1, 2, 3, you're going to drop it into my hands. And they do it. And the parent is sitting there thinking, oh, that's all very well. They won't do that with me. Why are they doing it with Julie? Why are they doing it with Philippa? And they can't do it for me. What's wrong with what I'm doing? And so the resistance or the shame or sense of failure can be really huge in witnessing the therapist, the worker, being able to engage in a way with their child they haven't been. And I've known that to cause quite a break. A kind of, oh, we don't want to do therapy anymore because she's doing it with you, but she won't do it with us. And that takes a lot of thinking about, actually, who am I to her? I'm not in a relationship yet with your child. I don't matter. I'm not the one keeping her alive. I'm not the one putting her to bed at night, taking her to school, feeding her. So actually, the child can take a risk with me in a way they can't yet take a risk with you. But I think that can be very painful for a parent to see a practitioner, therapy practitioner, have what looks like a lovely time with their child. And then they try the very same thing at home and it goes haywire.
Yeah.
And I can understand the pushback from that. That takes a lot of courage.
I think it does. And also the resistance then that I think you can find in the session from parents where it feels like they want to show you the behavior that you should be seeing. So some of the interactions between the parent and the child trigger a dysregulation. So the parent or caregiver can't sit back and allow the interaction between you and the child to continue. They interrupt that somehow. And I don't think that's a conscious thing. I don't think that the parent, the carer, for 1 minute is thinking, okay, we're going to make sure that they are not having this fun. But I imagine there's something inside internally that's really difficult. And there's, if you just did it this way, you'll see.
Yeah, I want it to be seen.
And because it validates to my experience because I'm telling all these people how awful it is, and you're just seeing this nice bit. So I'm going to show you. So there's this, it's almost like they interrupt. And that in itself, I guess it's that hidden compliance. So there's we're doing it, we're doing it, we're doing it. But actually, there's this undercurrent of they're not really doing it, or there's a correction, or the facial expressions, or the moving away of the body, or the telling you of all the negative things that have happened in the week. And say when you're doing it, that saying something like, yeah, when you were at school, you didn't do that with Johnny, did you? Do you know what I mean? There's this kind of, and that in itself, I think, is resistance, but it's from a place I often think of, I need you to see what I'm experiencing because I don't feel that people are believing me or they're minimizing my experience. So I'm just going to show you how difficult it is. And I know. And so they interrupt that back and forth, that serve and return, that those in the moment moments. Yeah. And I think as a therapist, that's really hard to work with because the point of therapy, well, I suppose to Sandra, to anything, is to have those in the moment experiences where the child is in their whole brain, regulated in their body and connected to the adult, because that's the thing that's going to make the difference. And in that moment, like you say, they're practicing and it's safe. And that is going to be beneficial in the long term outside of the therapy. But for parents, it feels like it's an unvalidated experience. And having those conversations, I think sometimes you just have to sit with, yeah, but this is shit for me. And just be able to have that time and validate, I know this is really hard. And I know that this isn't what this looks like at home. But this is what we want at home. This is what we want you to have. And let's think about what's different here than there. But that's hard when you're living it every day.
Yeah. And so that kind of, I mean, that seems such a common experience, Philippa, as you're speaking. I've got so many families in my head where actually they are so delighted when their child is super dysregulated in the therapy office because finally somebody else is struggling in the way that they're struggling. Suddenly the child has slapped me, or the child has run off and won't come back, or the child has stripped off in the session on a really cold day and won't put their clothes on and is wanting to go back to the car like that, or the child has thrown all the food around or tipped the drink out. There's chaos in the room. And actually, I can sense, I wouldn't call it joy in the parent, because it's not joyful.
It's a relief, I think.
A relief that somebody else, even Julie, can't manage my child. So this really is very serious.
Yeah.
And actually, I've seen that so often as a turning point where they've gone, thank goodness isn't it difficult? You have experienced what we are experiencing all day, every day. And that actually allows us then to unpick, exactly as you're saying, how could small things be tweaked? What is the moment where that happened? What was the build-up over several days? What was going on there that triggered? And let's try together. So sometimes I know there's been those big explosive sessions, and then we've maybe cancelled the next one just to give everybody a bit of a breathing space. And I've gone to my supervisor with the video of all that has happened. And I had my work validated as well and feel that there's somebody else alongside. But I think the flip side of that is sometimes, I don't know if you've experienced this, a resistance, and absolutely understand it from the parent, the carer, a resistance towards change. So even if there is change, even if there is something hopeful, even if something is beginning to feel safer and more regulated from the child, that is in itself really unsafe for the parents, because it might mean all the professionals disappear. It
Mm.
might mean everybody says, oh, you're doing fine now. So actually, to get better, and I use that very loosely, but to heal, to get better, might actually be scary for the parent and could be scary for the child.
And also, sometimes parents, carers, professionals are thinking, okay, it's something else. So it's ADHD, it's autism, it's something else. They can't be seen at CAMHS or somewhere like that until they've done the trauma work or the attachment work. So they don't want anything to change. They just want to tick the box of, I've done the attachment work. So now you can give us this diagnosis, and then we can have some medication. And the medication is the thing that is going to solve it. No, and again, I'm not saying that as in a blame way, because actually the information that is out there, when you Google these behaviors, when you go onto forums, it is often all about neurological disorders that are going on, ADHD, autism, dyspraxia, all those sorts of things. So for parents, you can see that feels like this is the answer. But somebody's saying to me, you can't, and that's a professional resistance, isn't it? From to parents from other professionals of say, we know better than you. We know better. It's not this. You have to go and do the attachment work. That is probably going to solve it. If it doesn't, then you can come back. But that takes years. And you can feel that a parent in that frustration. So in some ways, they don't want it to change because their goal is to get here. Therapy is not their goal. Do you know what I mean? And that, again, that's not about a blame. That is just that often the lack of support, the lack of information, the lack of stuff that's out there because services are under-resourced and understaffed, that they feel that this is going to give them help at school, it's going to give them help at home, it's going to give them the whole package, whereas other things give them little bits here and there. It doesn't give the whole package. And so you can see that can be difficult. And it's, I guess for me, I often think about sitting with the and both, which is we've talked about before, is that it can be both. It can be both these things. This might fill some gaps in, and that's really great. And there might be some stuff left. And then we can go and we can say, and I'll support you in that, to say, we've done this work, we've filled these gaps in, but this is still there, or this is getting worse, and it's more than. But that I think that parents have often had to fight so hard, and there isn't a clear path or a clear level of support or a clear bit of information, that when they feel that this is the answer and they're living with this difficulty, then you can see why they're resistant to other stuff, because they just want their child to have the life that they wanted their child to have. And that's so hard, I think.
And it is that and or and both and many, and no therapy intervention, no medication is going to immediately change things. But sometimes, and I've seen quite often, a combination of ADHD medication or some sleep medication and some therapy and some parenting thoughts or consultation with parents and some school liaison can make things a little easier and a little better for now. But of course, we're working with young children and young people who are changing physiologically and emotionally. They are changing at such a rapid rate because of their developmental stages. And so nothing is, in my experience, nothing is going to be the answer that will solve everything forever. And I'm very cautious in the way I speak with families before I start working with them, that this is not going to solve everything. But who else can we involve in this? I'm always most delighted when I'm, say, working with a child to do play therapy or life story work, that also they're seeing CAMS, and also the school is involved, and also there might even be grandparents involved, other carers who are with the child at other times, not just their parents. For me, that's where it all works best. And together we can celebrate the little pluses and moments of, oh gosh, a year ago this was happening. Look, now that's happening. And for me, it's been very rare that a session of therapy has changed things. I've had one time where it was a family where it was at risk of breakdown, a young adopted child who wouldn't allow the parents anywhere near her. She'd become really attached to the dog in the family. And she was a little, I don't know, 3-4-year-old who was very much saying, I can do it myself. I know how to do that. I don't need you. And she absolutely desperately needed them. And in the very first therapy session, huge amount of resistance from her. But both parents and I just kept going. And after the blanket swing, you know, where we swing them in the blanket, it was little enough for us to do that. Gosh, I don't know how she did. She melted. She allowed herself to be wrapped up. She allowed herself to be held in a parent's arms and be fed a bottle and little biscuits. And we were all weeping because none of us expected that to happen. And I suppose that's the only time where I've felt that absolute magic happen so quickly. But that did allow those parents to go, actually, because we know this can happen, we'll keep looking for it. We'll keep looking for it. And as far as I know, they're still together. But I'm thinking in play therapy sessions, where it's usually that I am with the child on their own, and the parent is sitting in a different room. So in my home, they're sitting out in my hallway, often with headphones on. I've never asked parents to wear headphones. And there's just a door between me with the child and them. But I've noticed recently a lot of parents have asked for the Wi-Fi code and they've plugged themselves in to music, to a book, they're in their own, they're having a moment on their own. But I think also because they don't want to hear what's going on, or they might be very curious, but they're giving the child the respect and the confidentiality. I don't have the luxury of lots of doors between a waiting room and the therapy room. But I also wonder what it's like for the parent to have their child in this confidential, or I'd say private to the child space, where generally I don't share with the parent the details of what goes on in the room. I check in with the child, what they're happy with me sharing. Most children say, oh, you can tell them anything, but don't tell them about that. So I'll be very clear not to do that. I can share the general thoughts, feelings, themes, that's fine. But I have in the past met resistance from parents that I'm having an experience with their child that they're cut out from, is how they experience it.
Mm-hmm.
I have very frequent reviews. Quite often we have email exchanges, telephone calls, pass thoughts on to one another. But I've met resistance, especially if it's a private pay family who are not being mandated, or there isn't a funding source from elsewhere, who might suddenly put the brakes on and say, it's not making any difference. I don't like, and then sometimes we'll say, I don't like you working with my child in private like that. Why am I not allowed to see and hear everything? It's my child. And gosh, I can really sense that. But I also see the child as my client rather than, it is always the parent and the child, but I'm working with the child, and some children really need that private space to begin to do and say things, to practice things before they're ready to do that with their parent. And And I always want to respect that. That is my core training, and I always come back to that. But I can understand sometimes a parent might put the brakes on for the child, or it could be the parents are not living together and one parent is very keen for it to go ahead. And maybe reluctantly, the separated parent might say, yeah, all right then. So I'll take that as assent for going ahead. But I can sense that one or other or both of the parents are not feeding the child, but speaking about the therapy in a way that puts it down or
Mm.
diminishes
Diminishes it.
and that I think makes it really hard for the child. So I know there is then being reluctant resistance from the referring parent to say, mum is really not happy with this, let's just call it a day, because it's making visits to mum really hard, because mum keeps saying, why are you seeing that therapist, what are they saying to you, you don't need therapy. And we've called it a day, because actually to keep going in that atmosphere is too much pressure on the child.
Yeah.
So there's that sort of resistance as well.
I suppose what the other one is professional resistance from other, and that's not that parents, foster carers, adopters aren't professionals, but I suppose professionals with a job role or with a job title.
Yeah.
Although I guess foster carers, adopters, parents have got job titles, and I guess that can be towards the parents, and the parents can feel that, and you as the therapist are supporting parents, and that can feel really difficult because you are working with the other services within the system. So you might be working with schools, social workers, CAMS, or trying to get them into CAMS, all those sorts of things, and you're supporting the parent, and there's this resistance towards the parent, and the parent can feel it and you can see it, and you're managing that, I think, can be quite a tightrope, isn't it? Sometimes I can see that CAMS or the social worker or the school are being really bloody unreasonable, or have assigned a kind of made an assumption about this family, or they've got some preconceived ideas because they haven't, again, spent the time. And that's not a judgment, that
No.
services are so stretched, aren't they, that having that time to sit, that we get the privilege of being able to have an hour and a half once a week, stuff like that, and really listen and hear and be with it with a parent. Often social workers, schools, CAMS are gatekeepers. They don't have that, so they have to make assumptions, judgments on a lot less information or a lot less time spent than we do. But
Yeah.
I think walking that tightrope can be quite tricky, I think. And for parents, it can feel demoralizing for them, and it reinforces that judgment and that I am not good enough when you got a judgment or a resistance. Yeah. And it's that, and often with professionals, it's an underlyingness, isn't it? It's not overt, like actually they're doing rubbish, or we think it's like this undercurrent of kind of just little remarks or little things that you can feel it, but it's hard to call it out.
It is really hard to call it out. And I think of working, as I have done for many years, in primary schools. So in the UK, 4 to 11-year-olds, 4 to 12-year-olds. And I've worked in schools for many years as a teacher. So the person in the room with the class. And then I've worked as a play therapist and theraplay practitioner in schools. So I'm fortunate in the sense that I can see it and feel it from many different angles. So as the class teacher, we used to have an art therapist work in the school, or several art therapists, and you'd just got all your groups sorted for a maths activity. And it had all worked out brilliantly, and you set all the children off, and then there's the knock at the door that says, can I have Chloe for therapy? Or can I have Chloe? And just, my heart would sink. One, I'd forgotten. And then, I just got Chloe into a group, and it was going to be a group task. And feeling, gosh, I wish I had an hour a week to spend with Chloe, because I know Chloe's got stuff going on. I'm just making up the name Chloe.
Yeah.
And then having to reintegrate Chloe back in the class an hour later, and she might be really wobbly or she might be really quiet. And the therapist then traipses back to the therapy room. And so I would often feel I wish I could get to do that. And in fact, I think that's a big part of why I then did go and train to be a therapist, because I'd quite like to be the one-to-one person. So I can see it from the teacher's point of view, actually, how frustrating it can be.
But I also wonder, like, working with schools, and again, there's a vast experience. I've worked with lots and lots of schools over my time, from nursery schools right through to colleges. And I feel that sometimes school social workers, everyone, they are really open to having the conversation, to wanting to be involved, to really think, oh yeah, okay, we can incorporate that, or we can do. When we think about Sarah Lloyd's bus, you interviewed Sarah Lloyd, that building on developed sensory systems. If they can work alongside, or you're thinking about movement breaks or brain breaks or whatever it is, and some schools are just so fantastic at it. Other schools are so closed, and the resistance is, no, we know, we've been doing this long enough. We know what we're doing. It works for all the other kids. We don't have time. And that level of resistance can be so tricky. And I think for parents, it's frustrating for me as a therapist, but for parents, you can think, actually, you're sending him out of the class 4 or 5 times, telling him he's a naughty boy. If you just give him a movement break or let him go, and then he's getting out the class the same one way or another. Do you know what I mean? And that frustration to the resistance of, let's just think about doing this a little bit differently. We're not saying that you're not skilled. We're not saying that you're not doing a great job with all your other kids, but that I think from schools can be tricky.
It can be really wonderful when it works together, when there are those teams around the child meetings, and where there is that deep respect of one professional to the other. And I've been in many situations where I have felt that respect, and I've been able to give that respect to the others around the table, where it's maybe the parent is there, sometimes the child is also there, the social worker, the foster carer's social worker, the foster carer, and we can really be a team around the child and think together and respect those professional differences, but also, wow, sometimes I'll think, I've never thought about it from that angle, never thought about it from that angle. Can I tell you where my mind is going with this? And I've had some wonderful experiences like that. And I think the child, whether they're in the room or not, always benefits from hearing the grown-ups or feeling the grown-ups around them. Maybe holding differences, but holding those differences respectfully. And I absolutely get what you said earlier on. Sometimes when you meet another professional, their eye roll or their sigh might say, it's been really difficult in their past working with this family. Oh, you'll keep meeting with Chloe's mum. Oh, good luck with that. And I haven't even met Chloe's mum or know anything about Chloe yet, but sometimes a school or a social worker or a foster carer can set me off on a resistance path myself. And I find it really hard sometimes that actually I'm going to meet this parent for the first time. maybe in the school, and coming into school, I recognize is really tricky for some parents because they've maybe not had good experiences of school themselves. And so coming into a building, pressing that buzzer, getting through the gate is hard. And it could be that they're called 3 or 4 times a week to pick up their child, or to be told so and so's not. I'm going to keep using Chloe. Sorry to all the Chloes out there. I don't know why I picked on Chloe today. Chloe's not had a good day today. You need to take Chloe home today, or Chloe's done this. And so coming in to see me, say, as the play therapist, is yet another stress and sometimes embarrassment for that parent.
Mm.
And I'm always careful, and I teach my students to be careful about when we gather information with the parent, have that first couple of interviews with the parent. Tell me about Chloe, what's been going on? Tell me about you when you were little, what's there? Then I check in with the parent, what's private between me and them, and what can be known by other people in the school or in the social care system. And quite often I've had parents saying, I've never told anybody else that, or I don't want anybody else to know that bit just yet. And I've got 2 parts to my forms, and I've got a big red bit that says, this is not to be shared. And I think that's really helped parents to trust me in working with them and their child, is that I don't then share all their information.
Yeah.
Because so much is written on so many systems without the consent of the parent that everything is shared. Because I would want to know who's going to know stuff about me.
Yeah.
Where it's.
But I think just going back to professional resistance, I think that is a hard thing for parents to work with, but other professionals. And I don't think always that professionals feel that they're being resistant. Do you know what I mean? That it's just, this is the way we do it, and this is the way it works. This is what the system says we do. This is what the form says we do. This is what our gatekeeping says we do.
Yeah,
So
it's our
there's
pathway.
a hide behind, this is how it works. But that is resistance. That is no, we're not changing. We're not looking at this. We're not able to incorporate it. And that's not, like I say, that's not judging the school or the teacher or the social worker. But I think sometimes we have to stop and think, who is this serving? What is that about? Do you know what I mean? If you've got a kid who's leaving the class 3 times because you're sending them out because they can't sit still, but your policy is that's what you do, and they have to go to the reframe room or the nurture room, whatever you call it. It's all the same
rainbow
thing.
room, the blue room.
It's still an exclusion from the class, isn't it? It's a rejection, it's a disconnect, but that's happening anyway. But so that's happening. Why can't we just shift it and think, this is what the child needs, let's deliver it as an adult? This is a bit that frustrates me, is there's a resistance to thinking about, actually, you're going to get the same thing, but let's just do it in a different way. But because the system says this is how it's meant to be, there's a resistance to changing that. Or the form says we've got to. Can you get that information in a different way? Do you know what I mean? Can you walk around the playground with a kid? Can you have a cup of coffee with a parent? Can you have a Teams meeting with? Do you know what I mean? There is other ways to do these things, I think, but we get professional resistance. And I think that might be, for many reasons, it might be the pressure on the system itself. It might be the stress that the professionals under. It might be that they don't feel confident in doing something outside. I've talked, haven't I, about that imposter syndrome, and so it's not about judging it, but that is resistance, and it can be tricky for me as a professional. I think if you're a parent working within it, you're just trying to get an EHCP. Bloody hell, the resistance around trying to get an EHCP, even just starting that. And that is because the system's saying no more EHCPs because we can't afford it. But actually, the need is for the child, not the money. But do you know what I mean? So it's like we're pushing a rock, but the system is resisting.
So the EHCP, it was the Education Healthcare Plan, which I think is just in England, maybe in Wales as well. I'm not quite sure, but that plan that has to go to the local authority and be approved, and then that potentially gives extra funding to the school to provide extra support for that child.
Or move school or
to
anything.
get
Yeah.
into a particular school. And
CAMS, getting into CAMS, the same. The resistance to that is, oh my gosh, yeah, it drives me crazy. And some of my best friends work in CAMS, so I know they're overworked and overstretched, but oh my gosh, the resistance to that is, oh, yeah,
because there's
horrific.
accountability and resistance in the big systems is huge. It's a huge part of it. So I, as the worker, may have one idea, the parent might have an idea, but the resistance can come from paperwork, pathways, the system that says this has to happen before this and this, which is why I love now doing some private pay work where parents phone up, they come and meet me and they say yes, and they bring their child. Yes, they're having to pay for that. And I don't think parents should have to pay for the healthcare of their children. But it is an immediate way of seeing some children who are in distress.
And again, the system shouldn't. There's a resistance there, isn't there, too? Where do you get that from? How do you do that? We could all go into the GSF, but we won't go there. And the fostering changes and all those sorts of things. But I think when you're trying to navigate that and you are already under stress as a family and you've got things going on, then if you can afford it, then that's great, isn't it? But what happens if you can't? What happens if you're on benefits? What happens if your immigration status isn't set? What happens? And all these other things. And what happens if they need the mental health expertise of CAMS or a psychiatrist or a psychologist? What happens then? And you can't get through the resistance to get to that point. I think for parents and families, that is horrific. And then they come and see us and they've had all these experiences and they've had to battle through. And then I'm sitting to them and saying, just tell me about it. They're like, oh my bejesus. Yeah, really. I've been telling people for the last 4 years. I've eventually got here. It's not really what I wanted, but you'll do because it's better than nothing. And then my job is to sit with that or to help them battle the resistance. Because I think sometimes that is my job, is to write to CAMS, to write to the GP, to write the paediatrician and say, actually, this is what this family, they need some support that I'm going to give them, but they also need your input, your support. And my job is to be alongside them, battling that resistance a bit more for the short amount of time that they can be with me. And then they have to wait for 6 months before the next set of funding comes through, or they self-fund or whatever it is. It's just, you can see why parents get to the point where they're sitting with us and saying, oh,
that resistance to hope. I know we're coming towards the end, I think, for today, but where is the hope in resistance? Where you are putting yourself forward as an advocate for your families, and absolutely we can use our sort of professional power to do that. And I think as a social worker, within an organization, you have more voice than I have as an independent play therapist at the moment, I think. But how do I use my voice to get others on board to notice a family? And what are my resistances? As also, this might even be another whole episode when we think about the impact on us as the professional, when we experience resistance from the child, from the adults, including parents, carers, and other professionals.
And sometimes you get in trouble, Julie. I
That's a
often
whole
get
other
in
episode,
trouble
Philippa. Let's
because
stop recording.
for pushing against resistance, because people don't want you to. So they write to my boss and say, I don't think they should be doing this.
So that's a whole other episode, or perhaps a private play episode of Philippa Kelly's resistances in this work. But so much of our work is the working in the room with the parent and the child. But also, increasingly, I find so much of my work is the systemic understandings, the negotiating, the setting up a meeting, attending a meeting, proposing a conversation. And I find so much of my supervision, when I'm receiving supervision, is not always about the child in the room. I'd say actually quite a small part of my clinical supervision is about that. So much of it is about the meeting of resistance in the system, in the parent, in myself, that I need the skills of my supervisor to help me navigate, because it's a constant push-pull. It makes the work very rich and exciting, but it's in my training, I don't think that was a huge part of my training. It's the bit in the room with the child I often see as the easy part. It's the getting to the room and the child and staying with the child in the room and having the funding and the wherewithal to do that. That's the hard bit often.
Yeah. And I think just as we wrap up, what I would say is for resistance that we get from adults, I think for me, it's about just exactly the same as it is that we talked about when we talked about children. It's about being alongside and understanding. You don't always have to accept it. You can challenge it if it's not, if we think it's not helpful for the family or helpful for the child, whether that's with a parent or a professional. But I think it's not, for me, it's about thinking, okay, why is this there? What is the purpose of it? What is the understanding? And rather than making a judgment of it and then thinking, okay, so how do I get alongside that? And then how do I have the conversation about it? And some of the conversation might be with the empathy and the understanding and the, oh my gosh, I can really see that this is hard, and about validating those experiences. Some of it might be around, I can see why this is where you are. Actually, I don't think it's really helpful. How can we do something different? Do you know what I mean? You can have the challenge of it, but I think before you can challenge it, you have to understand it and be alongside it. It's not about a conflict, is it? About resistance against resistance. It's about, okay, I'm getting that you're overworked, or I'm getting that you're thinking I'm not experiencing what you're experiencing at home, or whatever it is. Let's think about how we work around with this together.
Yeah. Yeah. And that's ultimately what all of our work is about, is there's something that feels gritty, or there's something that feels messy, or there's something that's misaligned. Can we dare to sit and look at that together? It's almost like put it in the middle of the room. And rather than me having a conflict with you, let's put our conflict, our difference, our resistances into the middle. And then rather than looking at you and I directly, we can both put our gaze towards the thing that feels gritty. And it's what I do in therapy with children, and it's how I try and work with parents. we look at something outside ourselves and put it in the middle. Hence me often making that cup of tea or inviting them to do something with figures or use a sand tray, because then we can look at it outside ourselves. It's not about a personal conflict or a personal resistance. But there, I think we need to leave it today. Thanks for the
Absolutely. So thanks for listening to Pondering Play and Therapy. As always, subscribe, leave a comment. All those things help with our algorithm and also lets us know that you're listening and enjoying. So thanks very much for taking the time to listen to this episode of Pondering Play and Therapy.
Bye-bye.